Hey, Nick here, Dialysis nurse. So, I'm going to talk about pain with PD. So, this is initially starting PD. This isn't if you've been doing PD for a long time and you suddenly get drain pain or shoulder pain. This is initially right after the surgery. You're doing your flushes with your nurses and you have crazy pain and discomfort and you don't like it and you want to know why. So, first of all, I will say the first thing that's going to happen is you're going to get a flush. After your surgery, you're going to meet with your PD nurse, and he or she is going to put a little bit of dialysate fluid in your cavity, in the catheter. And then once that fluid's in, they're going to drain it out. That's just to make sure the catheter is working absolutely fine. Now, if you're experiencing pain during the flush, then that's what I'm here to talk about right now. Not pain while you're doing treatments. I'm talking about in the very, very beginning. So, I wrote down some reasons as to why you may be getting this pain. So the first thing is the catheter. So pretend this is the inside of your body, and this part right here is in your body. This is the tip of the catheter that's in your body. So the catheter tip may be rubbing against the lining of your cavity, which doesn't feel pleasant. It's like taking a straw and rubbing it against the inner area of the cup. So your cavity could be super, super sensitive because it's never experienced something like a plastic tube inside of it before. So I recommend when you're getting your flush, change your positions. Lie down. The chair should recline. Lay back. Go to one side. Go to the other side. Sit up. Try to change your position so that catheter tip isn't brushing against the inner workings of your cavity. And make sure the nurse knows this. Talk to your nurse, ask her if you can move positions, or ask him, her or him, whatever. And if that's the reason as to why this is happening, then you have your answer right there. So changing positions when the fluid is going in or out can help keep that tip from scratching at your cavity. Stretching. So I was looking for a balloon, but I couldn't find one. So when that fluid's going in, you just feel uncomfortable and just crampy, like, man, it's just, I feel so bloated. That's because you're not used to having all this fluid in your system. So your cavity is usually like this big, and now you've made it this big by adding all that fluid. This is going to just take time. It's like a balloon. I don't have a balloon, but the first time you blow a balloon, you really have to really blow. You really have to stretch it out. Now, if you let all that air out of the balloon, it's going to be pretty flaccid, right? Blow that balloon up again, it's going to be a little bit easier. Let that air out, blow it up again, and it's still easy. So the more and more you do peritoneal dialysis, the more times you put fluid in and let it drain out, the easier it will be on your cavity. It'll be able to stretch easier and easier. So this just takes time. What you can do is you can ask the nurse to start with smaller volumes. If he put a liter in and you were like, oh man, this is uncomfortable, ask if you could put half of that in. Ask if you could put 750, 500. Start slow and slowly increase to add more and more fluid until you feel comfortable. This is all about you. It's not about the nurse. It's not about getting you in and out, not about hurrying up so we can train you. It's about your comfort. This is your life. So if 1 liter is too much, if 2 liters is too much, we can start slow and gradually increase until you're comfortable, like that balloon. Another thing that kind of touched upon, nerve sensitivity. So your peritoneal cavity, where this catheter is hanging out at, all these, the inner areas of your cavity, it's sensitive. It's nerves all over the place. And for some people, it is very, very sensitive. So like I said before, if you have the catheter brushing against it, that may cause you to have some kind of pain or discomfort. But also, when that fluid goes in your cavity, if it's cold and not warmed up to the proper temperature, you're gonna have cramps. It's gonna be extremely uncomfortable. So make sure that the nurse puts warm fluid inside of you. If something happened, the nurse had to use his or her warm fluid for somebody else, and the nurse is like, I'm sorry, but we don't have warm fluid right now. It takes 5-10 minutes to warm up the fluid on the machine. So just say, hey, I'll wait. You can go ahead and warm the fluid on the machine and then put it inside. Don't let them put room temperature to cold fluid inside of you because it is extremely, extremely uncomfortable. And also, once you're done training, never microwave the solution bags. I had a patient do it once. It can cause hot spots. It's just is bad. Just take that time to warm it up the proper way. Never put it in the microwave. That's just an FYI. So another thing that can happen, which is extremely rare, is diaphragm pain. So right here is a muscle that your lungs sit on top of. It's called the diaphragm. Sometimes for some people, it's really rare, when fluid goes into their cavity, the fluid touches the diaphragm and it causes crazy, crazy referred pain. It causes shoulder pain, it causes back pain, and you're like, wait, but you're talking about if the fluid touches the diaphragm, why is it hitting the shoulders and the back? That's why it's called a referred pain. Referred pain means you have pain in one place, but you know that the issue is down here. So the nerves that touch this area connects to the shoulders and connects to the back. So that's why some people, when fluid goes in, once it touches that diaphragm, pain here, pain in the back, very uncomfortable. For those people, take small breaks. Put a little bit of fluid in, take a break, put a little bit of more fluid in, take a break. I heard stretching it out, moving it around a little bit helps, but it's really, really rare. I've never seen it before, but I've heard about cases where patients had diaphragm pain. Another thing that can happen, which shouldn't happen when you get flushed, this happens once you're done training or even during training sometimes if you get complacent, but air. If the nurse is flushing you and the nurse accidentally instills air, puts air inside of your cavity, that air will travel up, eventually land in your shoulders and cause intense shoulder pain. Now, I've heard the pain being just uncomfortable to extremely severe. Sometimes it lasts for 3 days, sometimes it lasts for 2 weeks. It all depends on how much air you put inside of you. So Tylenol is the only thing that we can give you, and the air just has to dissipate throughout your body. So it's just a time thing for that. But hopefully that doesn't happen during your flush because the nurses should know what they're doing. The last reason why you could be experiencing extreme pain is the flow rate is too fast. The fluid's going inside too fast and it's being drained out too fast. So ways to mitigate this, if you're doing manual dialysis, the higher the bag is, the faster it goes into your body. The lower the bag is, the slower it'll go into your body. So lower that IV pole a little bit to make it go slower. If you're on a machine, the nurse can adjust the parameters of the machine so it's not going in or being drained out too fast. Another thing you can do is open your transfer set halfway. Don't open it fully, just crack it open just a little bit so fluid won't be able to rush in or rush out. And that's usually it. I didn't touch on drain pain. So drain pain is when I touched on nerve pain a little bit. So you have the catheter in your cavity. It's floating because you put fluid in your body. So when you start draining that fluid out, the catheter is going to fall down while the fluid's being drained out and eventually land at the bottom of your cavity. Now, sometimes when it lands there, that tissue is extremely sensitive. So when that catheter starts touching the inner area of your cavity and eventually the bottom, it's crazy, crazy pain. If this is the case for you, then you need what's called a last fill. That means that the nurse needs to leave fluid in. So when you're draining, you don't drain completely. You're still at a point where there's like 300, like a can of Coke is still inside of you basically. And that allows the catheter to float so it's not scraping at the insides of your body. But that's usually it. If you have that last thing, that drain pain, sometimes with brand new patients, you're still healing. And once you're completely healed, that drain pain will go away. For others, that drain pain is there and it's not going away. So you need that last fill, and you may need something called a tidal, but we could talk about that later. The doctor can also prescribe a medication for you to make your nerves less sensitive that you would take before doing dialysis treatments, but you could talk to your doctors about that. Hope this helped. Take care.